Thank you for joining us. Our names are Dr. Janine Collins and Dr. Grace Percalaba-Korn. We are both pediatric ophthalmologists, and we would like to talk to you about nasolacrimal duct obstruction. Nasolacrimal duct obstruction is a blockage of the tear drainage system. It is a very common problem. 5 to 10% of infants have symptoms of tear duct obstruction affecting one or both eyes. Here is an image of a normal tear drainage system. Tears are made by the glands located around the eye to keep the eye lubricated. Normally, after tears are made, they drain into openings in the corners of the eyelids by the nose, known as puncta. Then the tears drain through a system of tubes leading to the tear duct. Finally, the tear duct directs the tears into the back of the nose. This is why your nose may run when you cry. Blockage of the tear duct can occur anywhere along the drainage system. The most common location of a blockage is at the end of the tear duct in the back of the nose. This blockage is caused by the presence of a membrane, as shown in Figure A. Other causes of a tear duct obstruction include the absence or narrowing of openings in the corners of the eyelids, a narrowed tear duct system overall, as shown in Figure B, an abnormal nasal bone, or an infection clogging the system. Signs of a tear duct obstruction usually occur within the first few days or weeks of life and include tearing, red and swollen eyelids, eyelids that are stuck together, and yellowish-green discharge. Another sign of tear duct obstruction is something called dacryocystitis. This is a serious infection of the tear duct system, leading to swelling and inflammation of the tear duct by the nose, as shown in the photo. While this is uncommon, it can be severe and needs urgent medical attention. A tear duct may be partially blocked. In this case, the child can appear unaffected on some days and may have tearing and discharge on other days. These signs of tear duct obstruction can worsen with things like colds and flus, congestion, allergies, wind, and cold weather. A tear duct obstruction is diagnosed based on your child's history and a physical examination. Your doctor will want to know when the tearing started and if there are any things that make the tearing better or worse. In the office, your doctor will examine your child to see how well the tears drain. A colored eye drop can demonstrate the drainage as shown in the photo. Your doctor will also check for mucus buildup in the tear duct or if there are any signs that point to another cause for the tearing.
It is important to have your child examined by an ophthalmologist to evaluate why your child is tearing. An ophthalmologist can identify the cause of your child's tearing so that appropriate treatment can be started. Other conditions that can cause tearing include childhood glaucoma, conjunctivitis, allergies, and eye infection. While tear duct obstruction is common, the good news is that the treatment options for a blocked tear duct tend to be highly successful. Over 90% of cases of tear duct obstruction go away during the first year of life with observation or with treatments you can do at home. Treatments recommended for a blocked tear duct include observation, tear duct massage, antibiotic eye drops or ointments for infections or discharge, tear duct probing with possible expansion of the tear duct with a specialized balloon, and possible placement of a tube, also known as a stent, in the tear drainage system. Your pediatrician or ophthalmologist may recommend that you perform tear duct massages at home. This involves placing firm pressure over the upper tear duct and moving your finger in a downward motion over the tear drainage system. Mucus may appear around the tear drainage system openings by the eye or in the nose. This is normal. It is important to keep your fingernails short and smooth so that you don't accidentally scratch your child. With continued massage, you may be able to relieve the blockage in the tear drainage system. Antibiotic eye drops or ointment may be prescribed by your doctor as well. These medications may help if there is inflammation or a minor infection of the eye surface causing redness or mattering, but will not open the blocked tear duct. Often the eye drops are prescribed with tear duct massage. If the blockage persists, your doctor may recommend a tear duct procedure. In this procedure, typically a metal probe is passed through the tear drainage system into the nose in order to relieve the blockage. A tube may be placed at the same time, or a balloon made for the tear duct may be used to stretch the tear duct if performed under general anesthesia. In some situations, the probing procedure can be performed in the office using numbing eye drops. Tear duct procedures are safe and generally very successful. Occasionally, the tear duct obstruction returns and the procedure may need to be repeated. If the procedure is not successful, a more involved operation may be needed to relieve the blockage. Here are a few take-home points from this discussion. 5 to 10% of infants have symptoms of tear duct obstruction affecting one or both eyes. Most cases of tear duct obstruction resolve on their own during the first year of life. If the tear duct remains blocked, your ophthalmologist may recommend a tear duct procedure, which is generally very successful. For more information on this or other eye-related topics in children, please visit us on the web at aapos.org.